to be contagious. So, and these conclusions are, I think, very important also when you think about the next step, which is actually how to increase engagement in practice. So how to enhance work engagement? But before doing this, can you maybe open this? I have to make a general remark first, because when you think about increasing engagement, you're actually stepping outside the medical model. Because traditionally, in occupational medicine and occupational psychology, it was about curing. Somebody burned out or somebody had an occupational disease, you have to cure it. That's first. And then, of course, the question is, well, maybe it's better to prevent. Like in China, because in ancient China, the patients were paying the doctor when they were healthy, and they stopped paying the doctor when they got ill. So you can flip the coin and say, okay, it's better to prevent than to cure. But you are still working within the framework of the medical model, because there is some kind of bacteria, some kind of agent, biological agent, social agent, stress, and it's affecting you, and you have to keep that out. The next step would be, and there is no word for it, so I looked into my old Latin book and I thought, okay, implicit, that's a nice term. That means to increase, to enhance, to augment, to make it stronger. And there you are actually saying, well, okay, these people in the organizations, they are working well. They are not like having troubles. They are not burnout. We don't have to prevent something. What we like to do is to increase their functioning and to make them feel better. So it is actually making something better that is relatively working well. So increasing the quality of life and increasing the quality of work, actually. And not with the idea of preventing something. So this is a very basic kind of thing. And maybe you think that I'm talking now somewhat nonsense or so, and that this is not really applied, but here is 365, and 365 is the largest occupational health service in the Netherlands. It's a private business because occupational health services have been privatized since about 10 years. This is another story, very interesting, but I will not go into that. They serve 70,000 employees, employers, and 1.3 million employees. Maybe not much in Italy, but Holland has only 17 million inhabitants and 8 million workers, so it's quite a lot. They have 1,400 staff, 50 group practices, a lot of physicians and professionals. So why I'm saying that this is the largest occupational service in the Netherlands, has a wide range of services, and what they did is actually adopt the idea of implicit. So they have their services organized into 3 business units, 3 pillars as they call it. First one is treatment, which is the traditional occupational health directed to sickness absence. The second one is prevention in terms of lifestyle. How can you increase better lifestyle in workers by having corporate fitness programs, dieting, etc. And this third one is implicit, and it's about engagement. So this company actually has a business unit where 60, 70, 80 people are working, and they are implementing engagement programs in organizations. So what I'm saying, that's not only theoretical, but it's actually also a practical issue that is taken up by the largest health service company in the Netherlands. So actually, when you think about interventions, there are 3 types of interventions, and I will go after this a little bit more in detail about these individual-based interventions, because we have research on this, and on the others, there is not research yet that can be shown to be effective, and I'll tell you in a minute why. Individual-based interventions, you can think of, it's a behavioral interventions, implementing acts of kindness. Many of you will know this from the positive psychological literature. You can also have a more cognitive approach by counting your blessings, so telling to yourself, okay, maybe life is a little bit shitty today, but there are also some positive things that you usually don't think about. This is the idea that you don't think about, oh, I have my teeth are working. No, well, you don't think about that because you only think about it when it hurts. But you can now think about, oh, I have healthy teeth. This is good. I can eat a croissant today. So this is a kind of count your blessings. And motivational. That means specifying personally meaningful goals. Personally meaningful is very important here. Personally meaningful goals, and pursue these in a systematic manner. But as I said, I go into a little bit of detail here. Then we have team-based interventions, and we did some of these, but the problem here is a very interesting one, is when you think about team-based interventions, and I can also put the other one, organizational-based interventions, it's very difficult to show scientific results. I give you one example of how difficult this is. A couple of years ago, I did a research, did a study, an intervention study, in which we trained managers on, in one particular construction firm, a huge construction firm. We trained about 120, 130 managers how to deal with construction workers that are ill, because you had a protocol and you have to call and you have to talk with them and you have to prevent this, etc. And we had a control group. It was the same kind of construction firm that was not trained. And the whole program was meant to last for about a year. And what happens after 6 months? Those two firms were merging. So there was one firm, and the managers from one project of one firm were transferred to a project of the other firm, and our complete scientific design was ruined. So I'm telling you this because it is very, very difficult to show, let's say, scientifically sound effects in terms of increasing engagement or decreasing sickness absence when it comes to organizational-based strategies. And that's the reason why there is not so much literature on this. It doesn't mean that there is no work. And there are some case studies and stuff, but I decided not to present the case studies, but more the individual-based interventions. So there are team-based interventions, and typically you would like to participate people in these team-based interventions, and to have also a kind of action-based approach. So that means that you are not having a fixed idea about exactly what you're going to do, but you have a kind of method that you use with these teams to work with their strengths, for instance, and how that works out depends from one team to another. I did not go into leadership, but leadership is also very important, and transformational leadership actually means that the transformational leader has a kind of vision, an idea where he wants to go, she wants to go, and is inspiring and taking along the employees along that path. And increase, of course, self-efficacy, as we saw. Okay, I have two examples of individual-based interventions. One example is an e-coaching intervention to enhance engagement and self-efficacy among employees. And another one is a behavioral intervention to increase engagement and positive emotions among students. And now the light went out, and now the light went on again. Okay, magic. This e-coaching interventions we did together with a large Dutch newspaper. You see there the advertisements. This newspaper has a website. You could log into this website and take part in this e-coaching trajectory. It was actually for free for those who were having a relation with this journal. And what was it? The content was we gave people 12 assignments or brief behavioral experiments. So we said, for instance, today is you have a do-good day. And the do-good day means that you have to do 3 things that are good for your co-workers. Giving them a compliment, holding the door open, whatever it is. Or we said, well, I have other examples here. Well, it was about 10 to 15 minutes per assignment or behavioral experiment, having a cup of coffee with your colleague or giving a compliment.